This is Dr. Srinivas Jakka, consultant pediatrician and pediatric pulmonologist, Ankura Hospitals, Hyderabad. There is a lot of news about these viral infections in the media today. People are saying that there is a mystery virus circulating in Hyderabad. So I'm here today to discuss these viral infections in children with you and hopefully clarify some of your doubts. So today we are going to discuss why do children get these frequent viral infections? What are the frequent causes of these viral infections? What can parents do at home to treat them and how to prevent these infections? Firstly, let us discuss why children get these viral infections. Young children until the age of 3-4 years are usually at home. They are not exposed to infections. However, once they start going to childcare, whether it is a daycare, nursery or school, they come in contact with other children who might be carrying these viruses in the form of colds and coughs. So when these children cough or sneeze in their class, all the other children catch these viruses. So parents may be worried that their children are getting frequent colds and coughs every month, or some cases every 2 to 3 weeks as well. Sometimes these children carry home these infections and may affect other family members, especially younger siblings, and they too might be catching frequent colds and coughs. So these infections are usually carried by air and less commonly by contact from one person to another. So sometimes these infections may be overlapping very close together, so that for parents it might appear that their children is always suffering from cold and cough continuously. So what are the common viruses which children get? The viruses depend on the season to an extent. Usually summers children don't get much viral infections, but once rainy season starts, then they start with dengue fever, and this also followed by other respiratory infections like influenza or flu virus, adenovirus, which we saw a few months ago, and now we are seeing a respiratory syncytial virus or RSV. In addition to this, there are also other viruses like rhinovirus, a parainfluenza virus, human metapneumovirus, etc. So what are the symptoms of these viral infections? The symptoms depend on the body part affected and number 2, the severity of infections. For example, if the infection affects your nose, they may have runny nose, blocked nose, mouth breathing, etc. If the infection affects the throat, they may have pharyngitis, tonsillitis and inflammation of your adenoids, where they may have difficulty in swallowing, snoring, mouth breathing, etc. If the infection goes down to the level of your voice box and vocal cords, they may have what we call croup, where the voice becomes hoarse, and they may have what we call a barking cough. And unfortunately, if the infection spreads lower down to the lungs, in some children the airways become tight, and then the children will have wheeze and breathlessness or worsening of their asthma. In other children, it might cause a viral pneumonia where the infection involves the lungs tissue, and in these children they have worsening of cough, high temperatures, they may have breathlessness. Parents can recognize breathlessness by fast breathing and heavy breathing, where they may see indrawing of the chest and also the rib cage. So these symptoms involve different parts of the respiratory system. Sometimes the symptoms may affect other parts of the body. For example, if they infect the eyes, then you may see conjunctivitis or red eye. If the infection involves your gastrointestinal tract or the abdomen, they may see nausea or vomiting sensation, vomitings, loose stools, or both. And in addition to these viral infections, they may have generalized symptoms like fever, body pains, muscle pains, joint pains, nausea, vomiting sensation, loss of appetite, vomitings, etc. Now let us discuss how we can diagnose these viral infections. Viral infections are diagnosed mainly based on the symptoms we already discussed, and if more than one member of the family suffers from the same symptoms, for example, if 3 or 4 members in the family have the same fever, cold, coughs, body pains, it's invariably viral infections. And we can confirm the viral infections by some tests. For example, if the respiratory infections we can do a PCR. The same PCR we used to do for the COVID, we can do the PCR and we can diagnose these viruses very well. Earlier, this test was not available, but after COVID, this PCR test is widely available in various towns and cities in India. Is it possible to diagnose a particular virus without testing? Most often it is difficult because the symptoms of these viruses overlap. In other words, most of these viruses cause fever, body pains, cold, cough, sore throat, etc. However, sometimes there may be some symptoms which might be able to tell us that it is that particular virus. For example, there is a loss of taste, might suggest that it could be COVID. Similarly, presence of severe body pains along with similar complaints in family members along with colds and cough might indicate that it is a flu virus. Presence of conjunctivitis, vomiting or diarrhea may suggest it's adenovirus, so on and so forth. But however, in many of the cases, most of the symptoms are similar in all these viral infections. Blood test may be necessary to confirm dengue fever, but in other cases, a PCR is useful. How can parents treat these infections at home? The treatment for viral infections is mainly symptomatic and supportive. Symptomatic being you mainly treat the symptoms. For example, if there is fever or body pains, you can give paracetamol. If symptoms are not controlled with paracetamol alone, you can give ibuprofen or any other medication. Parents can use sponging with lukewarm water to reduce the temperature. You should make sure that the child has plenty of fluids orally and also that the child takes good rest. Avoid sending your child to school when they have viral infections. Then parents ask about, can my child get an antibiotic? It's important to remember that antibiotics are antibacterial medications. They are useful only for bacterial infections and they have no role in treating viral infections. Similarly, we tend to overuse a lot of cold and cough medications. These cold and cough medications can cause unpleasant side effects like drowsiness, thickening of secretions leading to blocked nose and constipation, etc. These medicines should be used only if the symptoms are troublesome. For example, if there is any difficulty in breathing or sleeping at night time, parents can give one dose of this cold or cough syrup so that the child can have a quiet night. Then comes the question, when should I take my child to a pediatrician? There are two indications. One is if the symptoms are prolonged or if the symptoms are severe or troublesome. So the first indication, most of the viral infections get better in 2 to 5 days and sometimes up to a week. If a child is otherwise well and has only cold and cough with mild fever, you can wait up to 5 to 7 days before you see a doctor. If the symptoms prolong more than 5 to 7 days, then you can visit your doctor who will advise you any further tests or treatment as needed. However, if the child has any severe symptoms or so-called warning signs, you should not wait for 5 to 7 days but see the doctor immediately. This can include symptoms like breathlessness, which we already discussed. Child is not eating or drinking. Urine output has come down. Child has high grade fevers which are not getting controlled. Child is not playing, not active, very drowsy. So when your child has this warning signs, you should take your child to a nearby doctor or emergency. Finally, how can we prevent these viral infections? COVID has taught us many hygienic measures as to how to prevent the spread of infections. We should continue these measures like hand hygiene, covering our mouth and nose when we cough and sneeze, avoiding going to school or workplace when we are sick. So following these measures in general will prevent the spread of infection. Similarly, using a mask when you are not well or during pandemics will prevent the spread. And particularly in children, regular use of vaccination will protect these children from vaccine preventable diseases. Parents sometimes ask, if I take a flu shot, will my child not get colds and coughs? Taking a flu shot will prevent infection from influenza or flu virus, which causes severe symptoms in children. However, it doesn't mean that your children will not have your coughs and colds. But it's important in some children to protect from flu. Similarly, parents will ask, what can I do to increase the immunity of my child? General measures like taking a balanced diet, which fruits and vegetables that contain all vitamins and minerals will help in boosting the immunity. Similarly, vaccination will help in boosting the immunity. And finally, parents should remember that as children get exposed to these viral infections in the first 1 or 2 years, their immune system becomes more developed to tackle these infections. And after 1 or 2 years, these infections become less frequent and severe. For example, we saw that between the first and third COVID waves, our immunity to COVID virus has increased and it's no longer a major problem as it used to be. Similarly, your children will gain immunity to the common viruses after a few years and they would not be as troublesome as before. Thank you.